Hey everyone, Dr. Alex Ritza here. Thank you for tuning in to another video. Today's video is all about trying to touch your toes. So many patients I take care of, they always lament that they haven't been able to touch their toes since they were a teenager. And this video is suited towards helping you do that by improving the flexion and flexibility through your spine and your hamstrings and the glutes respectively. And before we get into it, I'm just gonna ask you, if you like this video, if you wanna see more content from me, please like and subscribe. And so before we get into the routine, I think it's important to highlight some of the background of why we have some of the particular stretches and activities in this routine. Now, with being able to touch your toes, there are gonna be some genetic limiters, like say the soft tissue that surrounds some of the joints in the spine and in the body. If we do some ligament laxity testing in the office, we'll notice that some people, they just naturally have more flexibility through the joints of the spine and the hips and the knees that is gonna make them a little bit more able to tend over and touch their toes, and in some cases, palm the floor quite easily. If you're born with more ligament laxity, or if you did some athletics or dance or gymnastics as a kid that made you more flexible, that's gonna make this a little bit easier. But with time, if you've noticed you've lost the ability to touch your toes, it's often due to changes in the spine, making it less flexible, making the joints less healthy, less able to bend forward, and also the tissues through what we call the posterior chain, or basically the muscles and the soft tissues on the back of the spine, extending down through the glutes, extending down through the hamstrings, into the calf, into the muscles on the bottom of the feet, that make those muscles and soft tissues less extensible, less able to round forward. We're gonna be working on stretching those tissues as well as helping the joints of the spine flex and move forward. The third component in this, and maybe the most important one, is the last video you're gonna see in this, or part of the routine, is some strengthening through the abdominals and through the hip flexors. Now, why this is important is that if you are gonna be able to flex forward and touch your toes, you have to have the strength in the muscles in the front of the spine, in the abdominals, in the hip flexors. You're gonna need the strength in those muscles and the coordination to properly move each segment of the spine and to move the pelvis and the hips forward so that you can bend forward and touch the toes. Lots of people could have the necessary flexibility in the spine and the soft tissues, but if you don't have the strength to actually pull you forward, you won't be able to get there. So strengthen the abdominals using the safe exercise, the dead bug at the end. Very, very, very important. And with this routine, obviously, if anything hurts, stop, go see your local chiropractor, come see me, go see your physician, whoever takes care of you and your spine, because it could reflect that there's an underlying problem that needs to be corrected. But for the most part, all of these exercises are safe. So let's review the routine. Let's do it. So we start off with a seated cat camel. The goal with this is to try to get every single vertebra to slowly move more and more and more back into extension, and slowly more and more into flexion. I probably roll through this a little bit too quickly for some people. You should really focus on slowly bringing everything in, trying to round like the Arc de Triomphe as much as possible, and then extending everything back, thinking each little vertebra in the spine moving individually to bring you back in that position. With this, you might have some segments that are a little bit more sore than the other. Could reflect a problem in the spine that you need to get checked out, but with continued practice over weeks and months, it should get better. With this exercise, you wanna make sure nice, easy, deep breaths, so you're gonna maximize that mobility through the spine before we move on to the next drill. Our next drill, we're gonna be doing a prone or a quadruped cat camel. And this, similar, there are 5 things we need to think about. First thing, head falls gently to the ground. Number 2, then we push up as hard as we can through the hands, trying to round and arch the spine. Number 3, we want to make sure that we tuck the tail in or bring the pelvis forward, kind of like you're thrusting while having sex. That's going to really round and arch the spine. Number 4, We're gonna take a huge big breath in that top position and hold it for 1 second. And that's gonna arch the spine even more, putting some intra-abdominal pressure. And then number 5, we wanna make sure that we stay over top with the hips over the knees and the shoulders over the wrists. We then drop everything down into what I like to think is the camel position, where you have a hump at the shoulders and a hump at the buttock. You do this 10, 15, 20 times, really focusing on your breath and focusing on maximizing each one, and it will certainly help to mobilize your spine, allow you to get more aero. Next, we're gonna transition to an up dog, down dog series like we would in yoga. You can see me here, I'm pumping out the legs, trying to get some more flexibility, more mobility through the sciatic nerve and the hamstrings. Now, when I look at me doing this, I would like to see a little bit more extension where you can see my shirt separating from my pants. But then you'll notice I do a much better job of doing a full arch through the spine into extension with that up dog. And here we're trying to both move the joints of the hips and the spine, as well as the muscles around it, really trying to mobilize all of them, create some length, create some looseness or some stretching through the muscles that extend from the heels all the way to the top of the neck. And that is gonna help us on the bike get a little bit more forward without aggravating or bothering our spines. With this, you can go back and forth, and you probably want to go until at least you notice a big difference from the first couple, where the movement seems a lot more fluid, there's no pain or discomfort, and the stiffness really seems to relieve itself. And if you need to spend a little bit more time in one position or time pumping those feet to get some flexibility, that is a-okay. Go at your own pace, and again, nice easy breaths to make sure that you don't injure or bother your spine and get the most out of it. Next, we're gonna move on to the hip joints, bringing them up into flexion. We're gonna spend 30 seconds-ish or until you feel a loss of a stretch, bringing that knee to the chest, and then when you lose that stretch, you're gonna bring it to the opposite shoulder. This is gonna help to stretch out some of the low back muscles, some of the glute muscles, and a little bit of the hamstrings that again are on the back of the body that might limit us from flexing forward. Nice easy breath, so you can bring your arm out to the side to help stabilize the body, and you'll feel a bigger stretch through the spine and through the glutes. In this, I go pretty quickly from knee to chest because I don't notice much of a stretch there. For you, you might. Make sure that that stretch dissipates before you bring it across to the opposite shoulder. This is gonna stretch again, those muscles in the back, in the glute, in the hip, in the hamstrings, help loosen them up so that those are not limiters when we try to round our spine a little bit more forward when we are on the bike. Next, we're gonna go into primarily the hamstrings and the calves. You'll see in the next part of this video, I can use a towel. If you can't reach your feet, that's okay. We're gonna do some pumping just like we did to help mobilize the hamstring and the sciatic nerve in the calf, or that posterior chain on the back of the legs. For some people, this is gonna be a huge limiter. If it is, use the towel, which you'll see next, so that you can wrap it around the feet and you can actually get the most out of this stretch. Really important to breathe with this one. Really important to try and let the spine and the neck flex forward eventually as we're reaching further for the toes. And with this drill, you should notice a difference from start to end of how far towards the foot or how far on the foot that you can reach. You'll see the same thing I do with the towel. You're gonna pump those knees, flexing them and extending them a little bit. That's gonna help you get you into this stretch without hurting yourself. When you can get the knee closer to the ground and pumping it, and there's less of a stretch, then you can start bending a bit more forward through the spine, through the neck. Big breath in and let everything collapse as much as you can towards the foot and towards the ground to lengthen that posterior chain. Now, in this next drill, what we're gonna do is a segmental flexion. We're actually turning on the muscles in the front of the spine, joint by joint by joint by joint, trying to get the forehead as close to the shins as we can. This is going to both stretch the muscles in the back, but more importantly is going to activate and turn on all the muscles in the front of the spine that are needed to bring you forward and control the spine safely so you can get flexed forward. Feel free to try and palm the floor or bring the hands behind the calves to try and deepen some of that stretch. And at the end here, you can really hang out, taking nice easy breaths, focusing on all those individual vertebrae, trying to get the forehead as close to the shins as you can. Nice easy breaths, and really try to focus on that top of the head or the vertex, trying to let it fall as much as you can towards the ground and lengthening all the tissues on the posterior chain. And the goal is to make sure you feel a deep stretch throughout the entirety of the posterior chain, from the calves all the way up to the back of the neck. If you're noticing a point where the stretch is much, much deeper, spend a little time working through that area in this position or working on it through the cat camel until you come back to this and you retry it and it feels good. So last but not least, we've got maybe the most important exercise, and that is a bird dog. The bird dog is going to strengthen the hip flexors, the core muscles in the front, so we can actually control and hold ourselves in that forward flexed position. This, you do a reverse quadruped position where your back is on the floor and you're moving opposite arms and legs. The really, really important key here is to make sure that you keep the back, or the small of your back, pressed against the ground so that the rib cage does not flare upwards. If you don't do that, the whole purpose of this exercise is lost. You really want to make sure that with this drill, when you extend the arm backwards and the leg forward, that they move along a train track together, that they move parallel to the body, and that the rib cage stays locked down. And this is going to help us control our spine, control our core, and teach us to keep our core in a nice stacked up position while the arms and the legs move. This is similar to cycling in that the leg is moving up and down as we pedal, but it doesn't include the arm movement. But this will make that drill a lot tougher. And if you are currently doing abdominal crunches, stop those. They could be bad for your spine. This is a harder, safer, and overall better exercise to work through the abdominals. So I hope you found that routine helpful. I'm gonna let you guys in on a little secret. In our office, when we take care of somebody, sometimes being able to touch your toes improves with chiropractic care, and sometimes it doesn't. What almost always improves is the forward flexion through the spine and through the pelvis, because when I take care of somebody, their spine gets healthier, it moves better, they're able to bend forward more. But sometimes the limiter can be the hamstrings, the soft tissues through that posterior chain down into the feet. And for some people, even if their spine is super flexible, they still need to do some work to make sure that those soft tissues can move well. A huge asterisk with this routine is if you notice that you keep doing it and you're not getting any closer to the floor, or you notice that the hamstrings and the legs aren't limiting you, but the spine is, that's when you should see a professional. You guys know that my approach is always give you the tools to try and help yourself, but I'm also a big believer in asking for help, standing on the shoulders of giants when you need it, to make sure that you are not held back and limited by your body. Hope the video was helpful as always. Please share with some loved ones if they need some help with touching their toes. Expect this to take a few weeks to months for it to get better. The body takes time to heal, the body takes time to change, but if you can be consistent with it, doing it every day, or at least 3-4 times a week, you still should notice some changes. Until I see you next time, guys, please take care, be well, take good care of yourselves, and I'll see you soon.